everyone, and thank you for waking up with us to kick off our APTA Fight the Cut virtual rally. As you may know, this week we received word from CMS that they are moving forward with the 9% cut to physical therapy services that will take effect on January 1st, 2021. Now, it's absolutely imperative that Congress act to stop this cut. You've risen to the challenge time and again and answered the call to connect with your members of Congress, spread the word, and let them know how the cuts will impact you, your business, your patients, and so many other aspects of the profession. Today, we are rallying again as we near the end of the year because we must call on Congress to stop the cuts in their end-of-year legislation. Today's rally will feature an array of speakers throughout the day on how the cuts will impact the profession, the importance of raising your voice, and hearing more and answering your questions on the news from CMS. So today we're going to start with hearing how the 9% cut will impact physical therapy education. Here we have Valerie Strunk. She is the Director of Clinical Education and Associate Clinical Faculty at Indiana University's DPT program, a position she has held for 14 years. Valerie serves on the Indiana chapter of the APTA's Legislative and Ethics Committees and was recently elected to serve as a chapter delegate for the first time in 2021 and is a part of the Indiana APTA Advocacy Network. In 2019, she testified multiple times in front of the Indiana House and Senate on behalf of the Indiana APTA, which, along with the work of many others, resulted in a successful update of the Indiana PT Practice Act that year. In the Indiana University PT program, she teaches courses in PT ethics, jurisprudence, and professional issues. Her clinical practice background is in both acute care and neurological practice across the lifespan and in multiple practice settings. So welcome, Valerie. Thank you for joining us today.
Thanks for having me, Laura.
So we'll get started, and this is a really interesting angle on how the 9% cut will impact the work that you do and your space. So just tell us a little bit more about the work you do and some of the advocacy work you participated in.
Sure. So I am the Director of Clinical Education and a professor at Indiana University's DPT program. And what I do in that role is to make sure that I'm running and supporting 4 full-time clinical internships for our students. We have 3 part-time integrated clinical experiences and 2 clinical electives. I also teach the courses that you mentioned in ethics and jurisprudence and professional issues. And so I talk to my students a lot about legislative advocacy and the importance of active membership in the APTA in various points in our curriculum. And so this is a topic that is really important to me, and I'm trying to instill those values in our IUDPT students. The work that I do as DCE, as many people in the PT profession know, is I have 1 foot in the academic realm and 1 foot in the clinical realm because I'm bridging those bodies. And so a lot of times my work not only makes sure that students hit the ground running to learn and not detract when they're in the clinic from excellent patient care being provided by clinical instructors, but I also train and mentor clinical instructors and clinical educators in PT on the best way to teach our students. So that's my background. But before I became DCE, I spent 6 years in full-time clinical practice. And during that time, I was also a prolific clinical educator myself. So I've served as clinical instructor for lots of students, both just traditional one-to-one mentoring, but also I would take a lot of students that were remediating, so exceptional students that may need another try, and those challenges that went with that. I was also involved in collaborative experiences where I would host up to 3 to 4 students at a time in my clinical practice. And so I'm certainly well versed in the challenges, both in the academic world of education and the clinical teaching world.
That's great. So that's quite a resume, and that's wonderful that you get your students involved in advocacy because it's so important for people to raise their voice. So we just want to talk, the 9% cut news came out. How would these Medicare cuts impact your work?
Yeah, so the way that I understand how these Medicare cuts would impact the work of education is definitely based in lived experience. So we've all lived through past not only cuts or changes to reimbursement policy, but even sometimes just threats of caps or threats of changes coming. And we all know how that can shift the way that educators and clinics will budget for staffing and services within their organizations. So we're always asked and being asked as clinicians to do more with less resources. And these 9% cuts certainly are going to make an impact on the business of PT. And I know you have experts talking today about those specific impacts. So I won't go into those in detail. But we do have to understand, if we're going to understand how these impacts affect education, we do have to understand that these cuts are going to cause businesses and healthcare organizations to reassess whether or not physical therapy services have an effective cost benefit relationship. If it costs more to provide the services of physical therapy to our patients than we can afford to give as a healthcare organization, then those services will be cut. And so those cuts to staffing and services being provided by physical therapists will impact the ability for healthy clinical education programs to exist. Clinical education requires for both PT and PTA students the presence of a willing and able licensed therapist to take a student under their wing to mentor them. A student can't go and be in a clinic without a licensed professional supervising them, and so that relationship has to exist. A lot of times when cuts go into effect and services are slashed, productivity requirements are increased, and we all know that that means we have to decrease any services or tasks that we're doing in our jobs that are not billable so that we can continue to keep the doors open to the healthcare organization. Many things we do as PTs to provide care to our patient are not billable. Of course, the good example would be a lot of our documentation, a lot of the ways that we maintain our competence as clinicians. And yes, some of the things we do as clinical educators are not reimbursable. And so many times when staffing and services are getting cut, one of the first things to go is a ClinEd program. That's a long setup to tell you the story that I think had me here today, was that a few months ago, I got a telephone call from a clinical educator who I partnered with. She was the site coordinator of a statewide inpatient rehab facility that provides skilled nursing services and rehab services in nursing homes across the state of Indiana. And she had returned the offer form to our program to tell us what students they would be able to host in 2021. And as that popped up in my email inbox, I was sitting in my office and opened it up and my telephone rang. And it was the same site coordinator who was telling me she had just sent us the offer form for our 2021 students, but she wanted to tell me over the phone that those 6 offers that she was providing were contingent on these cuts not being passed. And she wanted me to make sure I didn't count my chickens before they hatched, because if the cuts went through, they were probably going to have to cut their student program. And that was what she had been told by leadership. And the resulting knot in my throat kind of terrified me as an educator, but it also didn't surprise me. We've been going through these sorts of things and decisions as clinical educators and DCEs for many, many years. And so that was the story that caused me to eventually write a letter to my congressman.
Yeah, that's really incredible. And, it really goes without saying, what would this do to the future of the profession if this continues?
Well, that's kind of an easy answer. If students don't have access to readily available and willing and well-staffed clinical sites, then we can't graduate our students, because accreditation requires that students do at least 30 weeks of full-time clinical education, and that depends on a healthy clinical education system. And so without the ability to do that, we won't meet accreditation requirements, which means our students won't graduate. So our profession is at risk.
Definitely. So we received your story because we had a call for stories because we were meeting with Senator Young of Indiana's staff on this issue. And, this was a really impactful story that was brought to that meeting. And it really helped us to shift our thinking to, the so many other aspects that this cut would affect with the physical therapy profession. So, it's really important to tell your story, and it's so important to just, let Congress know how this cut would impact you, your patients, your students, everyone. So, Valerie, in your words, why is it so important to tell your story?
Yeah, so with that question, I want to tell you exactly what I spend 3 years in our program telling our students. And it's that decisions are made by those who show up. And so you have to show up to tell your story. Sometimes showing up means showing up to serve your profession as a clinical educator, because then you get to participate in the decisions that impact what your professional peers are going to be someday. And that's a noble way to show up. Sometimes showing up means voting for professional leadership and governmental leadership that are going to be committed to making sure our future is bright. And today, what showing up means is sharing your story. And it's vital that we do that in different ways. The most effective way to impact change on a legislative advocacy platform is to just come together in great numbers. And so that's why a rally like today that is encouraging people to show up and tell their stories in great numbers can have a great impact. And I know you yourself have a lot of experience with grassroots advocacy, and you can speak more on that. But it's really important that you tell your story from your heart, and it doesn't have to be hard, and you don't need to worry about the words you use. You just have to tell the truth. And I think it's interesting that the whole reason I'm sitting here today talking to you is because I wrote a letter. I was sitting in my office when the call popped up in my email inbox that said, hey, we've got some people meeting with Senator Todd Young in Indiana. You're one of his constituents. Would you be willing to write a letter to just outline some of the ways that this would impact you? And I was used to writing letters that followed sort of the template online in the advocacy network that is on the APTA. But at that moment, I was pretty fresh off that telephone call from the site partner that I had. And so I had a truth in my heart that I hadn't expressed before that was really passionate from me. And so I took 5 minutes and I wrote a 2 or 3 paragraph letter. I sent it off to the APT Advocacy Network, and my understanding is it had quite an impact, and you can tell more about that. But I was proud to have that impact.
Yeah, and we appreciate you, sharing that incredibly powerful story. And, really your story can make a massive difference whether or not Congress acts on these cuts. And if so many people take the time to tell their story and tell their truth, that will make a huge impact. And as Valerie said, the strength in numbers really is so important. And my last question for you, Valerie, you teach students how to advocate, and, many of them have not participated in advocacy. What advice would you give for someone who is advocating for the first time?
I think that it's just really important that you don't get bogged down in worrying about what the right thing to do is. I think a lot of people, when I talk to my students and my peers about, sending letters and telling your story, a lot of the things that people tell me that is the barrier that they face in doing that is fear of failure or fear of putting themselves out there because they don't know quite what to say. And a lot of times they also don't understand that our legislators need and want to hear from you. And so it really doesn't matter what you say as long as what you say is your own truth. And so the first thing I would recommend is to call your members of Congress, both representatives and senators, today and urge support for HR 8702, which is what we're going to be talking about a lot today. And that's going to help offset the impacts of these cuts, which were passed. You can become somebody that becomes aware of other legislative advocacy needs by just being informed, being an active member of the APTA if that's at all possible. You can become a key contact for your state and commit to being a resource and an advocate when there's a need. At the very least, what you need to do is to stay educated and pay attention to the issues facing our profession so that you can spring into action, even if it's with just conversations and discussions with your peers and your family and your patients so that we can have the support of multiple different stakeholders. And remember that decisions are made by those who show up. And so you can't sit on the sidelines. The second quote that I like to give my students is also important to remember today, that if you're not at the table, then you're on the menu. And to stay off the menu, we've got to act. And it's really important.
Yes, absolutely. You know, I love those two quotes too. I say them all the time as well. So thank you so much for being here with us today and for sharing your story and for getting us kicked off with this Fight the Cut rally. So we appreciate you being here.
Thank you. Thanks for the opportunity.
Yeah. So as you can see, this cut will have far-reaching consequences. And now we need you to pick up the phone and call your members of Congress. So even if you've taken action already, we need you to do it again. Congress is currently drafting legislation as we speak that could stop the cuts, and we need to flood Capitol Hill with phone calls and emails today to let them know the impact this cut would have on the overall physical therapy profession. Your voice matters, and it just takes a few minutes to give your 3 legislators a call. Even if you get a voicemail, that's fine. There are people who work on Capitol Hill that will man those voicemails. They get thousands of calls a day, and they will listen to every voicemail. So don't be discouraged if you get a voicemail. It's so important to leave a message. And yesterday we put together a call script on the Patient Action Center that you can use that's really, really short. You can, rehearse it before you make the call, and you can leave that as a voicemail. But we really want to make it short. These calls last about a minute or two. So just be sure to keep your calls pretty, fairly short. But just tell your story and let them know, briefly how the cuts would impact you. And again, you can always email your members of Congress and really elaborate on that story as well. So as we continue with our ABTA Fight the Cut virtual rally, we encourage you to join us right back here at 12:30 p.m. Eastern Time, where we'll hear from Kendall Jean-Fin and Aaron Embry, who will discuss the impact of the cut on patients. And you'll also hear about advocacy experiences from these two and how you can get involved. And later tonight, we'll have programming here. And join us with Kara Gaynor, our ABTA Director of Regulatory Affairs, and I will discuss this week's announcement and what it means, and we'll answer your questions about that. So don't miss that coming up tonight. And if you follow us on Instagram, it's ABTA Picks. I've taken over their story today to talk more about the 9% cut, rally the troops with this virtual rally, and I'll be answering your questions as well. So please check it out, and I look forward to interacting with all of you on Instagram. So as Valerie said, decisions are made by those who show up. And let's show up, take a few minutes out of your busy day, and pick up the phone and call your members of Congress. It is so important. We don't have much time left before the end of the year, and this has to pass before the end of the year. So use our call script, make it your own, and let's show up. So everybody have a great morning. Again, call your members of Congress, and we'll see you back here at 12:30. Have a good day.